Hello and welcome to Haemcast. I'm Kathryn Jenner and I'm pleased to introduce another episode in our family-focused series with local families with bleeding disorders. Getting used to managing a bleeding disorder in a child can be challenging, particularly in the early days. Until recently, most treatments have been given intravenously, which represents a challenge in itself. Even using medical devices which are supposed to make it easier, like portacaths or ports, can have challenges. And of course, any treatment challenges that do come up impact both the child and the parents. Sam, Nicola and Andrew all have sons with severe haemophilia A. I spoke with them about the treatment-related challenges they've experienced and how they've managed and overcome them. Here's Sam.
We found out Archie had haemophilia at birth. We knew there was a 50-50 chance because of me being a carrier. So he was quite young. He was about 10 months old when he started treatment. And so he was about 10 months old, very active little baby, always crawling around. He had bruises everywhere because he was always kind of pulling himself up and falling over and all the rest of it. So they put his port in and started treatment. He had an inhibitor. That was a bit kind of worrying for a while, but that went. And he had his port until he was about 7. Port was perfect. Yeah, we had no problems at all. Treatment day would come, just bosh, in it went, and all good. So we'd have the kind of worry of like, oh, what if there's an infection and that sort of thing, but that was never ever a problem. And we talked quite a lot about the transition to veins, because I always had this feeling that it would actually be quite tricky for us to manage that, just because he'd sort of always been a child who didn't really like change. And I thought, this is going to be a big change and I don't think he'll like it. And we had kind of a day where his port just stopped working completely overnight. So we went into the hospital. And at that point, they said, no, we don't want to put a new port in. He's 2, he's 7, he's too old for that. We'll just go straight to veins. And so I remember kind of being shown how to access his vein, and thinking, I don't know if I can actually do this, and just being quite worried about it. But going home, and when I tried to do it, I panicked, which then he panicked. And really from then we had just a really, really tough kind of probably about 4 or 5 months. It felt endless. I mean, this must have been a Friday. I tried to treat him myself, and then having to go up to the hospital on the Monday. And we were there for the whole day because by then he just was terrified of anyone going near him with a needle. And in the end, they literally had to pin him down. They were like, really sorry, we're going to just have to get it in him. And we'd been there for about 8 hours at that point. And I remember coming home and thinking, I just don't know what we're going to do. And the consultant who we'd had since before he was born, she said, look, I think for a while you'll just have to come up here and do the treatment there.
While specialist support from staff at the treatment centre was hugely important for Sam and Archie, it came with its own issues, not least having to travel there and back several times a week.
We ended up doing Mondays, Wednesdays and Fridays, travelling up. They'd do his treatment, we'd kind of come home. And then the weekends would be very much like, well, if I could treat him, I would. And more often than not, I couldn't. And it would start up again. And I was working at the time. Luckily, I was kind of working at that point for myself. So I could sort of juggle work around it a bit, but it meant lots of kind of late nights working to kind of counteract the sort of days being in London. And I was kind of worried about all the school he was missing. I think it had been about 2 months of doing that, having that routine. And then they sort of said, look, this is really unsustainable for you, because it was hard going. And one of the nurses actually lived not too far away. So he would come in and do the treatment or help me do it.
For Sam, the most important thing in managing the challenges with Archie's treatment was really understanding where his fear came from. As she explains, it wasn't just a case of needle phobia.
Everyone said, well, he's got a needle phobia. Like, well, he wasn't really scared of the needle, but for him, he said that he can remember it hurt more going into his vein than it did going into a port, because the port you can't feel, can you? And he said, yeah, it was the fact that he could see this needle coming towards him, but he didn't know whether it would work each time or not. So there'd be all this fear around, is this going to work? I had exactly the same fear, because I'd be thinking, well, I don't know if this is going to work, and I'd be anxious myself. And sometimes, you put the needle in and the blood doesn't always come back straight away. And the minute it didn't come back, I'd be panicking and trying to move it around. He'd be panicking, which then makes, you're not going to get any blood coming through your vein if you're in a panic. I just remember this sort of relentlessness of just trying and trying again and trying to access this poor vein that was just getting battered and kind of going nowhere. And literally, it just took time, lots and lots of time. We had psychology appointments, things like that. But in the end, the only thing that really helped was just kind of keeping on going, and eventually it calmed down. But I'd say even up to a year ago, or maybe 2 years, but if treatment went wrong, we both would feel just so bad about it. So it took a long time to kind of almost get over the kind of all the feelings about it, and all the kind of fear of it not working. And even now, when I go to do it, I'm still like, oh, is it going to go in all right? Is it not? So it was that was probably the worst sort of time for everyone in the family, I think.
I was interested in what Sam said about her son not being very good with change, and that this sat at the root of his fear of treatment. From Archie's point of view, having treatment through a port worked, and he was used to it. The change to giving treatment intravenously brought a degree of uncertainty that he found hard to cope with, which was distressing for Sam too.
I know when this needle goes into my port, I know what's going to happen. Every single time anyone's done anything, it's been absolutely fine. I think it's like human nature, isn't it, to think I would be equally like that, of thinking, well, this works, and if I'm going to throw in uncertainty, I might not want to do it. Yeah. So I think for him, it was that a kind of combination of the fear, like this might not work every time, and actually he's having to rely on me to get it right. And I was being really hard on myself, I think. Like, why can't I get this thing right that seems really easy? But it's not. I think anyone that's done it will say, well, no, it's not really. It's kind of an odd thing, isn't it? That, as a parent, you're being given this job that to me seems quite kind of highly skilled. Your phlebotomists trained to do it. And here I am just being let loose on my child.
There's a massive emotional impact in there.
Yeah.
Stress and anxiety, not being able to give him the treatment that he needs, as much as the whole scenario around it as well. But with that traveling for his treatment as well, I mean, that must have had a massive impact on you energy wise as well, the two together.
Yeah, I think there was when I look back, I think it was a horrible time. In lots of ways, there were lots of nice things as well. It's an odd thing, because sometimes we'll look back on it, but actually being in the car, there's kind of we chat and listen to the radio, and so there were really nice things about that. And we just sort of had lots of little routines. Like once a week, it would be like, oh, I'll get you a treat from somewhere. So there were kind of things like that were nice, but yeah, there was kind of a big toll of just the tiredness, the sort of the heightened kind of got to get you here, get out. I mean, we'd literally be in the building for 10 minutes and then turn around and go. And trying to work around it. But I think the worst thing was kind of that feeling that I'm your mum. I'm meant to be here to make things better. And actually, I'm the one right now making things worse. I'm causing you pain, because if I'm getting this in the wrong place, it's hurting, and I'm not being able to make things better. So I think I just felt like I was failing all the time.
Sam's experience was being a parent trying to make things better for her child by treating him, but coming up against challenges prompting fear, stress and self-doubt. That's something that Nicola and Andrew are also familiar with. They have 2 sons with haemophilia, and the start of their treatment journey was far from easy.
For Eli in particular, his first year of life was probably our trickiest for him.
It was the darkest time, yeah.
It was very, very difficult. So he was part of a pup trial. So at 7 days old, he had blood tests, and they combined the heel prick test as well, but they did it through sort of veins. And he got his first bleed from that, didn't he, at 7 days old, because it wasn't held long enough. And the blood pooled and collected in his hand. So at 7 days old, he started tranexamic acid for that. That healed up in a couple of weeks, didn't it? It was, I mean, it was black and blue. At 7 days old, that was the last thing you wanted to really see.
First child as well, so we're trying to figure out parenthood as well as haemophilia as well at the same time. Yeah, it was tough.
It was hard. And then again, that kind of became a weak point for him, that hand. And then at 3 months, he knocked it in the buggy and got another bleed.
Same spot, yeah.
In that hand. And that's when they said at 14 weeks, it was time to put a port in. So he had port inserted at 14 weeks, it was, 14 weeks old. But obviously we had some complications with that as well. So when they inserted that, they put the tube into the heart and it knocked the heart out of rhythm. So he had a SVT.
Nicola and Andrew's son, then still only a few months old, had complications following the operation to insert the portogaff device that would help administer his treatment. He developed supraventricular tachycardia, or SVT, which means the heart suddenly beats much faster than normal. He was treated quickly and successfully, but there was more to come, including difficulties accessing the port, allergies, and an inhibitor.
So that was a rough first port visit, and then the port didn't go so well after that as well.
So he also developed, he's got a lot of allergies as well, and trying to learn to access that port, I don't know if it was because he was so little, it was just very difficult to get the angles right. It never seemed to work well, and obviously I put a lot of pressure on myself trying to learn it, and it was really difficult. I think obviously coming from that as well, where we had all this upheaval with that, he also developed a low level inhibitor as well at the same time. So we was having to travel up every day, wasn't it? They were giving him sort of an increased dose of the treatment.
Factor,
The treatment. And then one time we went up there because of his allergies. He couldn't have the Tecoderm, the sticky plastic
see-through plastic. Yeah.
So put the numbing cream on with a Meepor, so you couldn't actually see the site. When we took it off, it all blistered. He'd had quite an allergic reaction. The port got accessed and obviously pushed infection into the port. I think it was only in for about 4 weeks.
Yeah, 4 weeks.
The port. And then he developed high temperature. We was in a local hospital for about 3 weeks, 4 weeks. Then we got, I can't, it's all a bit of a blur.
It was 2 weeks, 2 weeks local, and then 2 weeks up at the main hospital up London.
Yeah, and then
they decided to get it out.
An infection led to Eli's first port being removed. He had a PICC line to help administer treatment while he healed, and then a second port was put in. But Nicola, by this time, was very anxious.
For me, I became very anxious around accessing the port because of the whole infection and all of the issues that we had with that. So you kind of took the lead on that for a little bit, and then once I regained my confidence, I kind of got back onto accessing it. But obviously he couldn't have any of the numbing cream, so we was having to go in without any numbing cream. So obviously that was quite upsetting because he would always cry. He was still very little. The port worked for a while, and then when he was 3, he got another infection in the second port.
That was after first time ever. I got into a good place with the port, really good place. And literally first time on my own without you here, like assisting, gave him his flush and his factor. Then I put the tray away, come back, and he's thrashing about, shivering like crazy on the sofa. and I called an ambulance in the end because I didn't know what was going on, but it turned out he was having a Rigors event where I flushed all the growth, whatever was going on in the port. I flushed it into his system, and he was having a Rigors event.
Eli was reacting to an infection in his system and ended up having another long stay in hospital. By this point, Nicola and Andrew had also had their second child, who also has severe haemophilia.
Again, I was in hospital for quite some time, and that was during just after COVID. So we had to separate. We couldn't see each other. I stayed with him the whole time.
We had Dexter at that point, didn't we, as well? So
yeah, and we were kind of just dropping off bags at the hospital door of clothing and things like that, because we couldn't see each other. And bless him, he went through I think we both did quite a traumatic time in the hospital, because obviously he couldn't have the numbing cream, having to have multiple blood tests. They didn't want to use the port, and he's obviously getting very upset.
It was at this point that Andrew decided that treating Eli intravenously would be a better option.
I had my fill of ports.
Yeah.
We'd been through too much of them, so
we said don't do it.
I was practicing at home on my hands, on my arms, on your hands and arms, on relatives' hands and arms. I was practicing on anyone that was willing to let me do it.
Yeah.
Luckily, my sister's a renal nurse as well, so she was helping me out. I was determined to not ever go back to the port. I know he was only 3 and a bit, and I thought we can't do this again. He's cursed the port on him. He's had a rough ride. He's been unlucky with a lot of stuff, and it was the only option. Like what Sam said, it's like you try and make things better, but it's just everything you tend to do, you try and do for the best with the best advice as well, and it never seems to pan out the way you hope it does. I actually do not remember much of Eli's switch from port to infusion. I remember a lot of the port, very, very little of the early days of infusion.
It was taking like 3 of us to hold him.
I think I boxed a lot of it off. Yeah. I think I put it in a box somewhere and just locked it up, and I ain't going to try and look at it again, because just the shake. The shakes were insane. As soon as I got that needle in my hand, it was uncontrollable, the shakes that I was getting, and the sweats. They're just flop sweats. It was like at some point it was dripping off my nose. I was in such a state, which obviously he can see. It's just traumatic for everyone.
The nurses were very good, so they were coming, but it was taking me, the nurse, and occasionally like mum and other people to hold him. We tried lots of different strategies where, because we found out it was more seeing it come towards him was when the anxieties and everything would kind of explode. So that's when we tried like VR headsets. We tried, holding the iPad up, putting YouTube on, like kids' YouTube on, letting him watch his favourite shows. Yeah, we tried lots of different things, wasn't it? It was a tricky time, but then slowly it does. Yeah. It gets easier. It does get easier.
Oh, he's great. He's 7 now. He's absolutely great with it.
Nicola and Andrew's younger son initially had a port to help with treatment. The early days of treating him were much more straightforward, but after their previous experience, and with more confidence in their ability, they decided to start on intravenous treatment with him from an early age too.
I said to him on one of this quarterly visits up the hospital, I said, I want to try. And they said to go for it.
We did a gradual phase.
Yeah, a very gradual phase. I'd mix it up a little bit. If it wasn't working, then I know I've got the port to fall back on. But no, it went really well with Dexter. And
I think by 2.5, 3.
Yeah, we had the port out. Dexter's port out before 3, and he's been good as gold as well.
Andrew, Nicola and Sam all spoke about really difficult, traumatic, frightening times. And they also all mentioned that the treatment issues they had to deal with made them feel like a failure. They all put a lot of pressure on themselves to get things right during hugely challenging times. I wondered how they'd got through it themselves and what kind of support they'd had.
I think we were offered counselling. We were offered counselling, especially after the initial port was put in. So we was offered that through the hospital, wasn't we? I think we kind of work well as a team, and we just kind of know when when we need to help each other out. So if I'm having a particularly bad day, you will take it on. And like, I was really struggling with Eli's first port, so that's why you kind of stepped up a little bit and took more of the training on at that time, because I wasn't ready to do it at that time after everything that had happened. And then kind of you've supported me through learning and getting that confidence back as well.
We struggled relationship wise. We struggled. It was hard. It was hard to just be a husband and wife. It's hard to be friends when you just got that constantly going on in the background, just waiting for the next infusion. So there's that stress was always lingering there in the background.
And that first year we basically lived separate because we'd constantly be at the hospital, or it was tough, but
a much better place now.
Yeah, you do get through that, and
you got to hunker down, hope that you get to the other side, and you do.
And it's nice to have those like the groups that you can go to, so the charities, and you get to meet other people who are going through the same things as you, and the children can meet, and you can kind of share your stories and think, oh, actually there are people that know what it's like to go through these situations. It's not just you, because it does feel like just you at the time, because there's not many people around you that are going through the same thing. So it's nice to actually have the opportunity to talk to other people.
What about you, Sam? What sort of support did you have access to when you were going through your toughest times? How did you manage to get through that yourself?
I had support at home. My husband was brilliant. Just at that point, there was just no one who quite got it, because they hadn't been in that situation. So I didn't know anyone else who had kind of the difficulty we'd had. And I think at that point, because it is sort of 7 years ago, there weren't quite as many sort of ways of reaching out. And I wasn't really one for Facebook and things like that at that point. So, but I had lots of good friends around as well who would kind of just try and support as much as they can. And I think the hospital, they were, the nurses, everyone they were fantastic. I think we're really lucky in that all of the professionals that we have contact with have known us since Archie's birth. So they're really they felt very invested in him and in us. It's always been about the support they give us as a family, not just him being a patient, it's all of us. So I think that they were always on the end of the phone to just talk and understand. And if I'd ring up and be in tears, and they just would just help by that kind of look, it will be okay. And even if I didn't quite believe it, I think that's what helps. More recently, we've had other kind of, I'd say, other issues, just like the whole kind of stage that I think probably all the boys go through of, I don't like having haemophilia, why have I got to have it, it's rubbish. But actually with that, his physio's just been, she was amazing, because he'd had some bad injuries that meant he actually ended up having to stop playing football. But she was just sort of relentless with him in kind of, he'd have lots of Zoom physios, because she was like, I don't want to keep bringing you up. And she would just really kind of talk and get kind of him at that sort of, I think this was when he was sort of 12-ish. And just really understood, and would sometimes just have a Zoom call with me just to sort of check in and see how I was and talk things through. And just that, when you think actually someone who's like, their job is that, you kind of think that's your job is to fix his body, but actually she was really kind of fixing his mind as well.
Sam, Nicola and Andrew were able to take strength from the support they had from family, friends, specialist healthcare professionals and patient support groups. I wondered whether conversations with their children about their haemophilia and treatment challenges helped too. Do you find that sort of talking about haemophilia and Archie's haemophilia with him, is that something that generally helps both of you? Is it something that you ever talk about as a family? Is that something that helps?
Yeah, I think it does. I think I'd always underplayed it. In my mind, I was kind of like, oh, well, there's treatment now. It's fine. It's kind of, yeah, but look, we're choosing to have a child, whether or not they have haemophilia. And so I think I'd gone into it with, when he was born, and people go, oh, how are you going to cope? No, it's fine. He's fine. He's just like every other child. We'll just do treatment. Da, da, da. And I think over time I realised actually that's not, like, from his point of view, that isn't true. So then you start kind of all the challenges then made me think, oh, actually life is really different for him in lots of ways. And he'd say, yeah, but my friends don't have to do this. They don't have to have treatment. So I think it's helped kind of, like, to talk it through. It's helped me kind of think, yeah, you have got actually something significant that affects your life, but we try and deal with it in a way that's, you live a normal life, but we acknowledge that, yeah, this is something that you do need to deal with. And maybe that helps, that all those conversations then help kind of him. He talks about it. At one point he never wanted anyone to know that he had it. It was a real, now he'll quite openly tell his friends and tell other people. So by maybe keeping it kind of in the conversation, it's maybe helped him do that as well, and for it not to be a taboo for him. And all the challenges you go through are what kind of build you and build your relationship with your child, and just, it's just becomes part of you, doesn't it? And sort of woven into, I don't know, the fabric of you.
Yeah. Nicola and Andrew, obviously your boys are a bit younger, but with again with the challenges and issues that you've had with treatment and infections, is that something that you've been able to talk about with them, or talk about as a family?
I don't know, it's hard to describe. It's kind of, they're on the, even though they are the patients, they have it. It still feels like they're on the outside looking in a little bit.
Yeah, they
don't really quite understand.
They have stopped in school before, and the all about me bits, and they will talk about going to the hospital and what that is, and what they kind of have a little bit of an understanding, don't they? And they do say, this is what it is. It just means I'm missing something in my blood, and I have Sharpies, and that lets me do the things that I want to do. So they do have some understanding of it, don't they?
Yeah.
But yeah, and they it's really nice. They support each other as well, don't they? So if Dexter sees Eli getting upset when he's having his transfusion, he'll come up to him and give him a hug and say, it's okay, they're just going to take a little bit of your blood and then they're going to push it all back in, and it'll be fine, you'll be okay. And he'll like kind of talk him through it, won't he? And Eli will do the same for Dexter as well, which is quite nice to see that they have that nice supportive.
Obviously, haemophilia is what it is. It's a battle, and the further it gets, once they're into maybe 10, it might get to a point where it is just a woven part of our lives. But sometimes it's still tough. I don't think it's going to be. I think we're going to have moments. I suspect there'll be moments when it will be even tougher, when they start asking more questions. That's going to be emotional again. But we're in a good place at the moment.
Just thinking about the challenges that you've had with treatment, what would you say to other families who might find themselves in a similar position?
Don't be so hard on yourself. It will come. We all, even from what Sam was saying as well, we all are very similar. It seems like we put so much pressure on ourselves, and that in turn can make things more difficult. So I think, be kind to yourself. Don't put so much pressure on, and just, it will come. And like we said, the hospitals and the nursing staff and the doctors, they are very supportive, and they will get you through it step by step. They're always there on the end of the phone, and just try not to put too much pressure on. And I know it's easier said than done. And I know when you're going through it, you're like, how can you not? We have to get it done. They need it. But yeah, I think coming out of that now, you can see actually, just don't put so much pressure on yourself. And we do all go through it. It's I know we haven't necessarily got those people to talk to, but we do all go through those same stages. From what it seems like from what Sam was saying, I was nodding my head. It just seemed like we were saying the same sort of things. We were going through the same, and we've never met before, but yet we're still going through those same things as well.
No, I'd say exactly the same, and just not be afraid to reach out. And I think there are more places to reach out to now as well. I think like with the local families group, that's a really good place to kind of to search for help and to ask for it, because everyone's so willing to give it. And I think just being able to talk about the whole experience, I think it's just reach out and trust that the hospital know, like the professionals there do know the right thing. They've seen it all before as well. But I think that reaching out to people is really important.
Time, patience and reaching out for support have played a huge part in haemophilia treatment challenges getting better for Sam, Nicola and Andrew and their families. And while it might feel like you're alone when you go through these things, you're not. Other parents of children with bleeding disorders are likely to have been through these challenges too. Thank you to Sam, Nicola and Andrew for taking part in this episode of Haemcast, and thanks also to local families with bleeding disorders. If your family is affected by a bleeding disorder and you'd like to connect with the local families group, you can find details of their website in the information for this episode. Thank you for listening. Join us again soon.